also wanted to review the data that was presented throughout the conference in relapsed refractory multiple myeloma. Multiple myeloma is one of the therapeutic areas that I'm most attached, and I really like to go and follow what's happening, and especially in relapsed refractory patients, because multiple myeloma has a very diverse armamentarium, treatment armamentarium. However, patients are still relapsing. There is no cure yet. So we do believe that having more combinations available and new agents as well will offer more opportunities for these patients and maybe for a potential cure. So the data that I saw presented is basically organized on several specific therapeutic agents. And I'll talk first about the bispecific antibodies because they are a very common direction right now that is taken in this category of patients. And the big advantage of bispecific antibodies versus CAR T is that they are widely available. It's an off-the-shelf product, and the patients can be treated right away. There was a lot of data being presented with different bispecific antibodies that have been already in clinical trials. And some of the most important ones are the BCMA CD3 bispecifics like teclistamab and elranatamab. And there was more mature data and long-term follow-up presented. And all this data confirms actually durable responses in patients that were treated with 3 lines or even more of previous lines of therapies. And the overall response rates are hovering between 60-65%. The complete response rates are equal or higher than 40%. And median duration of response of 2 years for teclistamab is actually showing very solid treatment potential, these bispecific antibodies. Another category, which is quite unique, is a relatively newer bispecific antibody, which is anti-GPRC5D and CD3 bispecific. It's called talquetamab. This talquetamab maintains actually a very meaningful activity even after prior anti-BCMA treatment, and it's increasingly used in bridging before CAR T treatment. And the potential of this drug was also, there are clinical trials trying to expand the potential of these 2 categories of bispecific antibodies by combining them. And there are several studies looking at talquetamab and teclistamab combinations in very refractory patients, in patients that have even extramedullary disease, and they do have good results. And cumulative, although there are cumulative toxicities, they are basically acceptable and manageable toxicity profiles with mostly infections and cytopenias among the most common is observed. So the practical shift that I saw in the bispecific antibody use is basically limited duration dosing. So in order to optimize the toxicity aspects, and also restarting the bispecifics at full dose without the step up after those interruptions in order to maintain disease control. The next treatment category is obviously the next generation CAR T. CAR Ts have made their ways. It's the anti-BCMA CAR Ts are very important in treating multiple myeloma. But right now, one of the aspects of CAR T treatment that was brought up at ASH is accessibility. And it is very interesting to actually visualize how very few patients have access to CAR T treatment. So although it's a great treatment option, it's very novel, it has great results. The fact that very few patients have access to CAR T is suboptimal. So trying to find CAR Ts that are widely available, it's been actually an objective of clinical research for a while. And there was data on allo CAR Ts at this ASH as well. And there were like a BCMA CAR T and allogeneic BCMA CAR T like a non-viral T-stem derived allo CAR T manufactured from healthy donors, and that would be fantastic to have that. The results were actually promising. It's early phase research, but with very promising results, and no GVHD as well, which is also very important in these allo options. So really looking forward to see at one point in time one of these allo CAR Ts actually being approved on the market. And also there was dual allo CAR Ts, so basically constructs that are having two targets, not only one. So obviously the allo off-the-shelf cellular therapies, the field is trying to broaden and getting more diverse. But as I mentioned before, I'm really looking forward to see some of these therapies actually making it on the market and see how that will actually influence the accessibility. So having more patients that have access to this treatment, it would be really, really important. Another treatment category is basically the novel immunomodulatory strategies. Immune modulation has been on the treatment of multiple myeloma field for a while, but now there are certain new immunomodulatory options. And one of the abstracts presented was on an updated phase 1 in heavily pretreated relapse refractory multiple myeloma with cevostamab. And the patients, the overall response rates were very promising, 40-45%, considering these patients had multiple lines of previous therapies. And even in patients that have previously been exposed to anti-BCMA agents, and they also had a very manageable low-grade CRS profile with step-up dosing. Another promising treatment regimen, and why I say it's promising is because it's looking at also enhancing the T-cell fitness and also looking at the microenvironment of the multiple myeloma, is basically a combination. It was a phase 1 study with a combination between Vactocertib and pomalidomide. Vactocertib is basically a TGF-beta pathway inhibitor, and in combination with pomalidomide, which has been on longer time, basically very encouraging progression-free survival in this study and compared to historical pomalidomide results. But as I said, important was that it's suggesting that is improving this regimen can improve the T-cell fitness, and it's also looking at the microenvironment modulating potential. I think the real world use and access was a very important point looking at the treatment of relapse refractory multiple myeloma. All of these analyses are documenting basically a very rapid uptake of bispecifics in community practice because they are more accessible. We're looking at ways of treating these patients with minimizing toxicities. And it's a lot of focus on minimizing the infections, dose holding, and also the bridging strategies before the CAR T. And as I mentioned before, the equity of access is something that the community is trying to achieve, and having some off-the-shelf CAR T options will basically increase accessibility to treatment.